Hey there, nurses. Let's talk about something we all care about: how to save on labor costs in healthcare. Managing labor costs effectively is crucial for any healthcare facility, and one of the main strategies is to minimize the use of overtime and agency staff. First up, let's discuss the cost implications of overtime and agency staff. When nurses work overtime, they usually get paid at a higher rate, often time and a half or even double their regular wage. While necessary in certain situations, relying heavily on overtime can seriously drive up labor costs. Plus, excessive overtime can lead to burnout, decreased job satisfaction, and higher turnover rates. Not good, right? Now, what about agency staff? These temporary nurses are brought in to fill gaps, especially during unexpected spikes in patient volume or staff shortages. However, they come at a premium. Agencies charge higher rates to cover their operational costs and provide flexibility. Over-reliance on agency staff can inflate your labor expenses quickly. So, how can we minimize overtime and the use of agency staff? Here are a few strategies. First, effective scheduling. By forecasting patient volume based on historical data and current trends, nurse managers can schedule staff more efficiently. For example, if a hospital knows that patient volume typically increases during flu season, they can schedule additional regular staff during these months, rather than relying on overtime or agency nurses. Staggered shifts can also help. Instead of having all nurses work standard 12-hour shifts, some might work shorter shifts that overlap during the busiest times. This ensures adequate coverage without requiring overtime. Next, cross-training staff. This involves training nurses to perform duties in multiple units or specialties. This flexibility allows staff to be redeployed to different departments as needed. For instance, a nurse primarily working in the surgical unit might be cross-trained to assist in the emergency department during high-demand periods. Imagine a hospital with cross-trained nursing staff handling a sudden increase in patient volume in the ICU. They can temporarily move nurses from the medical surgical unit trained in critical care to the ICU. This reduces the need to hire agency staff or mandate overtime. Finally, using float pools. A float pool is a group of nurses not assigned to a specific unit but available to work in any department as needed. This allows the hospital to maintain adequate staffing levels across various units without resorting to costly overtime or agency staff. For example, a hospital might have a float pool of nurses who can be called upon to cover shifts in different units, such as the emergency department, labor and delivery, or oncology, depending on where the need is greatest. Balancing cost control with patient care is vital. While minimizing the use of overtime and agency staff is important for controlling costs, we must ensure these measures do not compromise patient care. Adequate staffing is essential for maintaining patient safety, quality of care, and nurse well-being. The goal is to strike a balance between cost efficiency and high-quality care. In conclusion, managing labor costs in healthcare is a delicate balance. By using strategies such as effective scheduling, cross-training staff, and utilizing float pools, healthcare facilities can reduce their reliance on overtime and agency staff. This not only helps in controlling costs but also supports a healthier, more satisfied nursing workforce. Thanks for listening, and take care out there.